My name is Manuel Ladeira and I'm a specialist registered nurse, and I'm here to present you the abstract entitled Out of Hospital Cardiac Arrest during the COVID-19 pandemic in Portugal. There are two more authors of this abstract, Filipa Barros and Fátima Rato, both emergency medical doctors. The National Institute of Emergency Medicine, INEM, is the Portuguese Ministry of Health organization responsible for the coordination of the integrated system of medical emergency in Portugal, providing emergency medical care to trauma victims and to acute medical patients in pre-hospital set. INEM developed an out-of-hospital cardiac arrest registry that has been recently integrated in the iTeams tool, the national platform for clinical record in the pre-hospital environment. The first patient positive for SARS-CoV-2 was detected in Portugal on the 2nd of March, a time when the virus was already spread worldwide. The purpose of this study is to compare the incidence of out-of-hospital cardiac arrest in Portugal in the first months of the pandemic with the same period of the previous year. A retrospective observational study was made, and the data was collected from the Portuguese National Registry of Cardiac Arrest, and I've been told you in the beginning, between the 1st of March and the 31st of May of both years 2019 and 2020. During the referred period, there were registered in 2020 a total of 4,673 out-of-hospital cardiac arrest situations. That corresponds to 11% more than in 2019 during the same period. Here you can see the monthly distribution of out-of-hospital cases. No gender or ages differences were found between the 2 years. Regarding the location of the out-of-hospital cardiac arrest, it happened more frequently at home, with an observed decrease in public places. There were no major difference observed between nursing homes. The presumed cause of out-of-hospital cardiac arrest showed no major differences between cardiac etiology, that is by far the most prevalent cause of out-of-hospital cardiac arrest. Also regarding respiratory causes, nevertheless there was a reduction in traumatic out-of-hospital cardiac arrest cases. It was observed a decrease of performed CPR in all OSHA cases, as well as a decrease in the return of spontaneous circulation ROSC rate. The appearance of the SARS-CoV-2 pandemic brought some important changes both in society, such as the confinement decreed by the government, as well as for the daily clinical practice of emergency teams. All of these may be the part of the explanation of the 11% increase in out-of-hospital cardiac arrest cases. For the increase of the cardiac arrests at home, people were confined and maybe afraid to go to the hospital and not treating their pathology, and the decrease in the number of cases which CPR was started, maybe because there are some mandatory donning of PPE by the emergency teams and the strict clinical criteria for carrying out aerosol generating interventions such as ventilation, as a consequent decrease of ROSC rate. Concluding, this study is the starting point for further investigation, namely about trying to establish a correlation between the Portuguese data referring to the COVID-19 or even a correlation with the measures taken by the confinement, and then waiting for the second wave to go deeper in the investigation. So thank you very much for your time.